Hey, I'm Chris Smith, the co-founder, president, and chief medical officer for Ruby Health. The work we do is often informed and driven by the challenges faced by those closest to us, and I am no different. Let me tell you a story about my 96-year-old grandfather. He's a World War II veteran who still lives in the Long Island home he bought for his family in 1954. He has many ailments typical for his age: high blood pressure, atrial fibrillation, and blindness. One early morning, he felt dizzy, fell, and ended up in the emergency room. The hospital kept him unnecessarily for days, where he grew confused, weak, and discouraged. When he was finally sent home, the home health nurse found medication problems, no walker order, inadequate help, and no plan to fight his loneliness. My family and I had to scramble, pause one of the new drugs, arrange for a walker delivery, hire temporary aid support, and even connect him with a community-based social worker. A week later, he almost fell again, another near miss. Fortunately, he's fine now, but only because a doctor in the family could pull the pieces together, and quickly. Now imagine if every patient had that kind of fast teamwork without relying on a relative who happens to be a doctor. That gap is why we created Ruby Health.
Hi, my name is Nir Katz. I'm the co-founder and CEO of Ruby Health. So why did we start Ruby? Well, I was working at a health plan and had the privilege of partnering and seeing incredible impact that was happening across the country. There are a tremendous number of healthcare organizations that over the last decade and more have been innovating in all corners of healthcare, from primary care to cardiology to oncology, and doing quite incredible things. The shift to value-based care has been happening, and there are people that are devoting their lives to making sure that that shift fulfills its promise. And you're starting to see the results in all corners. That experience, that professional experience, collided in a very stark way with a personal experience. My father has been in and out of home health, skilled nursing facilities, and hospitals for more than the last decade with all kinds of health issues. And he credits his home health nurses and his doctors with saving his life multiple times, because they've done incredible work. And at the same time, what you don't see in home health are the types of innovation and modern care delivery organizations that have been sprouting up across the country over the last 10 years. And the need for it is there, because while the work that's being done is amazing, so much more could be done if you brought the same innovation that you're seeing in other places to the realm of the home, and in particular with patients that need skilled home health. And so we started to ask ourselves, myself and my co-founders, why don't you see that happening in home health? And what we quickly discovered is, while there's tremendous promise and opportunity specifically in the home where patients prefer to be, there's also tremendous challenges of delivering holistic, patient-centered care in a space that's outside of the office, that's in the home setting. And what we've done at Ruby is basically committed ourselves to trying to solve those challenges. And we know that the way to solve them has to rely on partnerships with the skilled home health agencies that have been doing this incredible work, like for my dad, for more than a century. And we are trying to empower those organizations and bring to them a partnership that makes available the best of all the innovation that we've seen in healthcare over the last 10, 15 years, and all the innovation that's occurring in technology today, for the sole purpose of creating the type of home health care that we would want for our friends and family.